have been 10 nurse practitioners for every 10,000 people living in Franklin and Southampton County. But now, families won't have to travel as far to see a doctor. News 3 reporter Penny Commit shows us the new clinic on wheels hitting the roads today.
This is a big deal. It's a very big deal, and I'm very, grateful for the opportunity of it being here.
Having healthcare in your own backyard, something that's never been a reality for Shatanya Pope and her son Bryson.
If he has an appointment in Chesapeake at 1 o'clock, I have to take a half a day off.
But now, a new healthcare clinic is officially hitting the road, filled with nurse practitioners and students ready to serve our rural communities like Franklin and Southampton County.
We are planning to bring increased access to health care for this population who are desperately in need.
Funded by a $4 million grant obtained by Old Dominion University, the mobile clinic will offer routine patient care, along with free optometry, physical therapy, and mental health care.
Anybody who's tried to get a mental health appointment knows that it's difficult because there are a lot of people now that need that and limited providers.
Jennifer Tyndall is the principal at Franklin's SP Morton Elementary School, which will utilize the van to get kids like Bryson the physicals and shots they need.
It's gonna be really easy and I won't cry.
Some children can't even start school because they can't get an appointment until after school is open. So the parents are frustrated.
This van also has some really cool telehealth capabilities. Let's say a specialist can't come out here in person. This Bluetooth stethoscope can be hooked up and then the specialist can hear my heartbeat through the monitor and give me the health care I need.
They come to the nurse and they have a fever and we say, well, they might have strep throat. We can Zoom with the parent, prescribe the medication. Parent comes and picks them up from the school, and not only are they picking them up because they don't feel well, but they've already been seen by a doctor.
Michigan, where a medical startup is hoping to reshape the healthcare industry by bringing doctors to you.
And this is especially important for the millions who live in rural areas, miles from a doctor's office. Kelsey Kernstein is live in Greenville, Michigan, with a story that you will only see here. Hey, Kelsey.
Hey, Marky and Adrian, it really is like a doctor's office on wheels. Homeward Health is trying to bridge the healthcare gap in rural communities. We spoke to one couple who says that without it, they wouldn't be able to receive the health care they need.
We've decided we're a lot happier living in the country than we are living where the hospitals are.
For Greg and Leslie Cornell, rural Michigan is where their heart is.
We built the home 50 years ago.
But now they're getting older. Greg suffered a heart attack. The nearest hospital is miles away. That's where Homeward Health comes in. How much do you think the rural community is in need?
I think there's a great need. There's a 23% higher mortality rate for those who live in these rural communities.
Offering mobile clinics and in-home visits to Medicare patients for primary care in rural Michigan, and soon expanding to Minnesota. Areas known as healthcare deserts.
I've had many tell me that they have nowhere to go, that there's nobody that they can turn to.
Physician assistant Jeff Anderson says many of the patients he sees haven't seen a medical professional in years.
We see a great deal of untreated diabetes, of untreated high cholesterol, blood pressure. We'll see skin cancers that have gone untreated.
It's typical in rural areas.
Would you like some lemonade?
For Greg, though, it was his chronic conditions that were left untreated.
They drew my blood, and next thing you know, I had a prescription for thyroid medicine.
Leslie says the care was so much easier than the hospital because Homeward Health came right to their door.
Well, they draw blood, they take your blood pressure, they check all the vital parts, and then they talk to you. And that's very important.
They take care of me like they're my mama, you know. They do well.
Greg and Leslie say that Homeward Health has been like a godsend for them. But we're here inside the mobile unit. Let's check it out. You can really see it is like a doctor's office. They have exam tables on both sides of the mobile unit, and they really have everything you can think of to make sure someone receives comfortable care.
It's the anthem. If I give you my word, that's what I stand on. Loyalty and trust is what I stand on. Family and love is what I stand on. Talking big, big. I knew that one day that I could make it big, big. I'm talking how to stay smoking without a city. Now we get up and do it like we got a big rig. It's getting serious. I know you're curious. See some losses through the process had me furious. But I got eyes on the vision, can't get delirious. Fall in love with the game and then you marry it. I think I married it. This the anthem. If you rockin' with it, put your hands up. Yeah. This the anthem. If you get up and get it, put your hands up. Yeah. This one for the winners if you with me, yeah. Hands up in the sky if you feel me, yeah. This one for the winners if you with me, yeah. Hands up in the sky if you feel me, yeah. It's the anthem. If I give you my word, that's what I stand on.